Addressing motivation. We already talked about this, the impact it has on a person's life. This is going to be different for each person, but really discovering what matters to them and what is interfering with their ability to have a life. So, for instance, someone who is having to endure some side effects, or is a pain in the neck, or I can't remember to do it. Let's say that this thing on the slide here, have a little sign, put a little note next to the bottle of medicine, say, I'm taking this for my granddaughter. And even better than that, okay, get a picture of your granddaughter, or a picture of your husband or your wife, or a picture of you in your fishing boat, because since you've been depressed, you haven't gone out and done something that you really enjoy a lot. And it's no kidding. This is a very powerful reminder, and have it be right there, okay? It really works oftentimes. Environmental engineering, you have to be clever about this, and again, it's going to depend on the individual person. But one thing that I have found to be very helpful is a person who kind of chronically forgets to take their medicine, and it turns out that it is about forgetting, it's not some other dynamic, is to have their bottle of medication taped to their tube of toothpaste. And in that way, every single morning, they are going to be reminded. I think there's ways to get clever about that. And in wrapping up, let me talk for a minute about informed consent. And I certainly believe that informed consent has a number of different meanings. One is just very legalistic about you're supposed to do this and this and this, or you can get in trouble with a licensing board, or it's unethical, or what have you. Nothing wrong with that. That's okay. But I think at the heart of informed consent really is the belief that our patients have the right to know enough information so they can make a choice about treatments. And it's mandated in many states, and it should be the law across the land, that once a diagnosis is made, that we lay out in front of our patients all the research or empirically validated treatment options and talk to them about the pros and cons. Now, every person is going to have their own preference. Some people feel like this is going to be essential to use medication. Other people may feel like psychotherapy or exposure-based cognitive therapy or something like that would be the treatment of choice. But it behooves us to be clear with the patient about the options they have, because really and truly, this is a fellow human being, and they've got a right to look at the data, to get a good sense about risks that are involved, and make choices that make sense for them.